Hello, this is anchor Disha Hazarika, and today we are at Assam Downtown Hospital. We have with us Dr. Indra Kuladhipati sir, serving as interventional cardiologist. First of all, thank you sir for giving us your valuable time. Today we would like to talk about some heart related problems. Like, before going to the topic, let us just briefly know about some common problems which is arising. Like, suppose my very first question to you is that we often heard in the news that people are dying from heart attacks and sudden heart attacks. Suppose if they are sleeping and they are suddenly dying due to heart attacks, and the main cause is heart attack. But we know that doing regular exercise is good for health. But what are your views on that? Doing over exercise is good for health, or is it risky for our heart?
Okay. So basically, if you have a heart disease, there are different kind of presentations. One is acute emergency, like acute presentation is a heart attack, and other is the chronic. It happens slowly. Because in acute cases, because it happened all of a sudden, it become some surprise or many times unfortunate for many of us. Now, in terms of who develop heart disease or heart attack, one of it from is a heart attack, there are multiple factors. One is age, then the presence of diabetes, cholesterol. There are so many factors. So, because of this, people have some changes in the body, and at time, if not been taken care of, it will develop acutely and have a heart attack. Now, what are the protective factors for heart disease, or rather prevention of heart attack is? One is exercise. If one person continue regular exercise, which is not 30 to 60 minutes in a day, moderate intensity, and continue for at least 5 days a week, then this helps to prevent heart attack or heart disease. So, if you take 100 patients or 100 individuals who are healthy, who are doing regular exercise, and 100 of similar individual of similar age group, then if they are not doing exercise, in those group who are doing exercise, in those cases, the chance of having heart attack is very low. But there are other factors to also account, like family history, then smoking, no smoking, then hypertension, diabetes. So there are multiple factors. More the number of factors, more the chance of having heart disease. In terms of exercise, if one person is healthy, or even somebody have a heart disease and being taken care of, once treated, if they continue exercise, depending on their physical fitness, depending on their physical agility, if they continue, that will help to prevent heart disease in future. In some cases, it may happen if you are doing too much of everything. If you eat too much, if you eat too little, if you do too much of exercise, if you are doing exertion and harming the body, then in those cases, it may harm the individual and can lead a heart attack, which is very rare. In some cases, if you have some disease already in your body, that means you have some symptom of heart disease, and if you are not taking care, you are not being treated, and then do exercise and do exertion, and then it may harm your body. So for healthy persons, doing regular exercise is helpful. Extreme cases can harm. That is like if you are doing a sport. Suppose you have never played football, and today without any practice you go to play football, you can have a join some fracture or some problem, physical problem. That is true for any kind of physical activity. If you do too much, depending on the person's level of fitness or having or not having disease, it can affect his future health. But in general, I think the regular exercise is helpful.
Thank you, sir. So, we often heard that going to gym is very popular amongst the youngsters. But we recently heard that doing when a person is doing gym and suddenly he calls like heart attack, we don't know the side effects of going to gym, but doing gym and suddenly stop it, do you think that it caused some problems?
See, there are two things. The same question has been asked by many of my patients or my friends. No, see, going to gym is like going to a restaurant or going to a kitchen. If you go to a restaurant, you have an option, no, what you are doing, no, what things will you eat, either it can be healthy food, unhealthy food. So going to gym also, gym is a place where you can do exercise, and there are options available. You can do cardio exercise, you can do resistance, you can do combination, you do flexible exercise. So gym does not mean you have to do a particular pattern. If you are going to a gym, then depending on your age, presence or absence of disease, your physical fitness, whether you are doing it for the first time or doing it regularly, depending on that, you have to have exercise regime, and then that you should follow. And that should be, when you're, at least for the beginners, if somebody doing exercise in a gym, they have to follow a scientific pattern, at least under supervision, so that body is not been damaged by any kind of a physical injury. But if somebody have like a middle age or elderly patients who have already some risk factors, if they are doing exercise for the first time, in those cases it is better to be careful. But otherwise, apparently healthy persons going to gym, doing exercise, depending on your priorities, because in going to gym for prevention of heart disease, I think mild to moderate, and a mix of both cardiac exercise, that means running or walking or cycling or some kind of aerobic activity, as well as resistance exercise in a balanced form. And as I said, 30 to 60 minutes in a day is helpful. Only in the extreme cases, you have seen a couple of cases last week also. One of the very popular sports person have an injury during gymnasium, but the physical injury may happen if you're not very careful. That is exception. That is very unfortunate but uncommon, and injury may happen. That is true for any kind of physical sports. So I think gym is not one place where you have varieties or options available depending on your priorities, depending on your goal, depending on your age, depending on your having or not having disease. You can choose a pattern which is suitable for you, and once you start, I think then obviously you can improvise under supervisions, and it is going to help in the long run to help you to prevent disease.
Institute of Urology and Kidney Diseases. In short, IUKD is the first kidney-related super specialty hospital in northeastern India, based in Sonapur, Guwahati. Under the supervision of eminent urologist Dr. Arup Kumar Nath, IUKD is the modern-day healthcare hospital with various facilities related to kidney diseases. All kinds of laser technology in urology and nephrology related issues are available at IUKD. For the healthcare services and facilities at IUKD, we can be reached at 98641 04444 and 88227 21671.
Okay, so my very last question to you is, what strategies should one adopt to eat healthy, doing exercise and stop smoking, and changes our lifestyle? I mean, which can change our lifestyle in a good way. So as a doctor, what do you suggest to our audience about changing our lifestyle?
See, if you realize that most of the things that we discussed now, like in terms of exercise, physical activity, eating nutritious food, not eating too much, then avoidance of smoking, alcohol, these things are helpful, and I think this is known to most of our general public. So knowing the things that these are good, these are bad, and those things apply in our life. I think these are two not exactly the same step. So first you have to know the thing, you should have information, and that you should apply. So it is not so that's why always for disease prevention is better. If somebody is thinking that okay, tomorrow if I get disease, I will take treatment, I will do this surgery, I will take this pill and I will be better. So because even after treatment, if the disease advanced, even after all kind of intervention, surgery, medicines, you may not go back to your normal health. So prevention is better. It is not a very good thing to have disease and then face the consequences. It's life becomes maybe very painful once you develop a disease. That's why if you realize that the health should be my priority, is my personal responsibility, and I'll take most of the steps or the possible steps to prevent disease in futures, and then to be like in a situation which is not obviously not welcome for all of us. So if you realize this fact, I think that it will be good for us many times, because see, most of the chronic disease develops slowly. So if somebody is smoking today, somebody is not doing exercise, somebody is eating unhealthy foods, obviously you're not going to have disease today or tomorrow. It will take some time, maybe 5 years, 10 years, or a couple of years, or a couple of decades, because it develops slowly. Probably by the time you realize it's become too late. Once you know that these things that if you with whatever you do as an action, that have a consequence in the future. If you realize that it is coming, and actually you are inviting it, that this is inviting, I think if you realize this thing, I think it will be helpful. And So I think in terms of prevention of disease, I said, no, prevention is that regular is not extreme, regular exercise. Then the food habit, healthy food. Healthy food means to avoid trans fat, too much of salt, too much of artificial food or preserved food, too much of processed food, red meat. Then smoking, absolutely no smoking. Alcohol, I think, should be stopped. Then regular exercise, and some of the disease like or risk factor like diabetes, hypertension, abdominal cholesterol, these they remain silent for a long period. If somebody have blood pressures, somebody have diabetes, somebody have cholesterol, they may not get any symptom today, but if not treated, they are going to have a problem in the future in terms of the cardiac disease or stroke. So control of these common factors, which are very common, diabetes, blood pressure and cholesterol, if abnormal, should be treated. And also at beyond certain age, once you are like in the middle age, then I think you also need to have a regular evaluation in terms of the blood pressures, of the basic investigations. And once you grow older and older, probably more like sophisticated tests, so that you can detect early. And if somebody have already unfortunately have developed disease, those can be prevented. And like heart attack, those can, because heart attack become an extreme situation where person develops suddenly acute problem and have long short-term consequences. So prevention is better. You can prevent by preventing the risk factors like physical inactivity, unhealthy diet. Second is that control of risk factors like diabetes, blood pressure, hypertension. And the next level is, suppose you are already developed disease, then proper treatment, early treatment. Even if you have advanced disease, then also timely treatment. So at every step is helpful. It is ideally you should start very early. That means to start healthy lifestyles very early on. And the person grow older and older, I think at frequent intervals, regular checkup, and any like disease has to be treated so that you can have a near normal life in future.
So do you think that regular checkup for a person is necessary?
Suppose the person is completely healthy, no disease, no risk factors, probably maybe 3 to 5 years. But if somebody have already had a stage where had developed some symptom or some disease like blood pressures, have a family history or abdominal tests, in those cases the frequency of interval will be more frequent. But so I think for everybody beyond certain age should have a regular checkup. How frequent it should be depending on the person's age and other factors. So I think regular checkup is mandatory. Like blood pressure, I said, common blood pressure and diabetes, majority cases remain silent. I have seen many persons who are absolutely healthy come to our office, BP is 200, not unusual. And if you do not treat, after 6 months, that person is going to have a stroke or heart failure. So regular checkup is mandatory. The component of regular checkup depends on person's overall medical history and age also. This is mandatory for everybody.
Thank you, sir, for giving us your valuable time. So with this, we are coming to the end of today's session. Thank you, sir, from the family of News Health Plus. Thank you.